If you've been told you have a disc bulge or disc herniation at L4-5 or L5-S1 and the pain is shooting down your leg, you're probably wondering if surgery is your only option. But here's the truth. Most people don't actually need surgery. The real question you should be asking is, do you need spinal decompression? And in this video, I'll help guide you through when non-surgical spinal decompression should be considered. Plus, stay with me to the end because I'll reveal a new robotic laser spinal decompression system that's been giving patients life-changing results with over a 90% success rate, something most people don't even know exists yet. Hi, I'm Dr. John Zalanka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. I've been doing this for almost 35 years now. My YouTube channel focuses on helping those who've been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash that subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs or surgery. I upload a new video every week. So when it comes to surgery and disc pain, if you've been told you have a lumbar disc bulge or disc herniation at L4, L5, or L5-S1, and you're feeling that sharp pain running down your leg, one of the first questions that comes to mind is, do I really need surgery for this? That's a scary thought. Surgery means risk, recovery time, and no guarantee that things won't come back. I have another video on this channel that explains the risks and failure rates of back surgery. I'll place a link to that video in the description section below. Here's what most people don't realize. The majority of disc bulges and herniations do not end up needing surgery. In fact, many patients get lasting relief with non-surgical treatments that take pressure off the nerves and give the body a chance to heal naturally. So if you're lying awake at night wondering, is surgery my only option? The answer is that for most people, no, it isn't. And here's something important. Just because you've been told you have a disc problem doesn't mean it will automatically get worse or lead to permanent damage. That's one of the biggest fears people have, that it's downhill from here, but that's not always true. Stay with me because in the next section, I'll explain what's really happening inside your spine when you have a disc bulge or stenosis and why that pain shoots into the leg. Once you understand that, the idea of spinal decompression will make so much more sense to you. So what's really going on? Well, when you hear the words disc bulge, disc herniation, or spinal stenosis, it can feel overwhelming. The big question people often ask is what's actually happening inside my back that's causing this pain. Here's a simple breakdown. Your spine is made up of bones, you know that, we call them vertebrae, and between the bones are the discs, so those are those soft cushions that act like shock absorbers. What those discs really do more than anything else is they provide space to allow those nerves to exit, because when one of those disc bulges or herniates, it can push out of place and it'll put pressure on the nearby nerves. So at the L4-5 and the L5-S1 levels, that pressure usually shows up as pain shooting into the leg, what most people call sciatica. If the bulge crowds the spinal canal, so that's where the spinal cord itself lies, that's called spinal stenosis or central stenosis. If it narrows the opening where the nerve exits, that's called foraminal stenosis. Either way, the result is the same. It's compressing the nerves that create pain, numbness, tingling, and weakness. So when you're asking, why do I feel so much pain in my leg when the problem is in my back? The answer is simple. The nerve being pinched travels all the way down into the leg, and when it's irritated, that's where you're going to feel it. And here's the important part. The problem isn't just the pain itself, it's the pressure on the nerve. So if you don't take pressure off that nerve, that pain often lingers or worsens, not just down the leg, but it can obviously be in the back as well. So that's why approaches like spinal decompression are designed specifically to target the root cause. So now that you understand what's happening inside your spine, the next big question is, what can I actually do about it if I don't want surgery? And that's exactly what we're going to cover in the next session. Introducing spinal decompression. When people hear they have a disc bulge or stenosis, one of the very first questions they ask is, what are my options if I don't want surgery? Well, here's the encouraging truth. For many patients, spinal decompression has become the non-surgical option. So what is it? Well, it's a specialized treatment that gently decompresses the spine in a controlled way, creating negative pressure inside the discs. That's important. It's the negative pressure which makes the key difference. It's not the same as traction. It is not the same as inversion tables. Those will never create negative pressure inside the disc. If you don't create the negative pressure, you're not going to be pulling the herniated disc or bulging disc back in. You're not going to be bringing those nutrients back in. You're not going to get any of those effects. It's that suction effect that can relieve pressure off the nerves, improve circulation, and give the disc space to heal. So you're wondering, well, will this actually fix my problem, or is it just going to manage the pain? The answer is that true spinal decompression is designed to go beyond short-term relief. Our goal is to give you long-lasting relief by actually getting to the underlying causes of the problem. Here you can see in our particular robotic laser spinal decompression system, we've got different robotic patterns. We have different laser intensity. You can't see, but the actually class 4 robotic laser comes right out from underneath the system here as well. There's the decompression tension. All of these things come into play, and it's by doing that, by actually it's designed to get that pressure off the disc and off the nerve, and that's what allows the body to finally start healing naturally. That's the big difference. Many patients with sciatica, numbness, or chronic back pain have avoided surgery this way. Now, is everyone a candidate? Not always. That's why a proper evaluation is needed. But for people with L4, L5, or L5S1 disc herniations, sciatica, or stenosis, it's one of the best first steps before even thinking about surgery. And here's something to keep in mind. Traditional spinal decompression has been around for years, and it's helped thousands of people avoid surgery. But as tech evolves, as technology gets better, and it's doing this at an alarming rate now, the question becomes, can it be made even more effective? In the next session, that's exactly, I'm going to show you how it's been advanced with new robotic and laser technology that's creating incredible results. So what exactly is non-surgical robotic laser spinal decompression? Well, for years, people have asked me, does spinal decompression really work? And the answer is yes. Traditional spinal decompression has helped countless patients with disc bulges, disc herniations, sciatica, stenosis, spondylolisthesis, all avoid surgery and get their lives back. It's been a proven option for decades, and I've seen the relief it can bring. But then the next question naturally comes up, if decompression already works, is there a way to make it even better? And the answer is absolutely yes. That's exactly what we've done. Technology in healthcare keeps advancing, and that's where something called non-surgical robotic laser spinal decompression comes in. This next level system that combines the precision of robotics with the healing power of laser therapy and spinal decompression all combined. So it's the robotic component ensures that each treatment is delivered with exact consistency and targeting, while the laser promotes faster tissue repair and reduces inflammation at the same time. Together, they make spinal decompression more precise, more effective, and in many cases, faster in giving people relief. And here's what makes it so exciting. In our own clinic, we've been seeing over a 90% success rate with this combined approach. It's really difficult to see on the system, but this is where we set the robotic patterns. This is the laser intensity. You can't see this in the picture. The class 4 laser is coming right from underneath the system here. Over there, you can see the amount of spinal decompression that's set up, the time intervals, and so forth. So that's what's so neat about all of this and why we see such a great success rate. Patients who thought surgery was their only option are finding real relief and a chance to get back to normal life without going under the knife. So if you're wondering, why haven't I heard of this before? You're not alone. Most people don't even know this type of advanced spinal decompression exists. And there are only 12 clinics in the world that offer this. And that's exactly why in this final section, I'll explain why you might want to consider it before making a big decision about surgery. So let's circle back to the big question, do I need spinal decompression? The truth is, no video can give you that answer, but to know for sure, you need a proper consultation and examination with a doctor who is qualified and experienced in this field. But here's what you can do right now. If you check off several of these points, it's a strong sign you should at least inquire about whether you're a candidate. Number one, have you been diagnosed with a lumbar disc bulge or disc herniation? Number two, does your pain radiate into the leg with numbness or tingling? Number three, have you been told you have central canal stenosis or foraminal stenosis? Number four, have you had chronic back pain or leg pain lasting more than 3 months? Number five, have you tried things like drugs, injections, physical therapy, and you still have your pain? Number six, do you want to avoid surgery if possible? And number seven, your symptoms are interfering with your daily activities, your sleep, and your mobility. If those sound like you, then non-surgical spinal decompression is absolutely worth exploring. Now here's the exciting part. Traditional spinal decompression has been around for years, and it's helped thousands, but non-surgical robotic laser spinal decompression is the most advanced version available today by far. There are only 12 clinics in the entire world that have this technology, and we're one of them right here in Ottawa, Ontario, Canada. In our clinic, we've seen over a 90% success rate with this system and our specialized protocols. Patients who thought surgery was their only option are finding life-changing results instead by coming to us here. To see exactly what that looks like, I've posted a video with 3 of the many powerful patient success stories we've seen. You'll find it linked in the description below. So if you're wondering whether spinal decompression could help you, and especially if you're curious about this advanced robotic laser system, please feel free to reach out. We'll help you find out if you're a good candidate. I hope this video gave you more clarity about non-surgical spinal decompression. If it did, please drop a comment below and let me know. And if you still have questions, leave them in the comments below as well. I do my best to read and respond to each one of them. Always remember, even with advanced disc herniations or spinal conditions, surgery is rarely the first option. You now have almost everything you need to make a more informed decision on whether spinal decompression could be right for you. Look for a qualified and certified spinal decompression doctor in your area, and if possible, definitely see if you can access a robotic laser spinal decompression system performed by an experienced doctor. It's not just the system, the doctor's experience and skill is invaluable. If you found value in this video, please like and share it so more people dealing with back or leg pain can learn about safer alternatives. And remember to subscribe now if you want to discover more advanced non-surgical methods to treat serious spinal conditions like disc herniation, sciatica, lumbar stenosis, spondylolisthesis. The next video you should watch is the one we talked about, 3 patient success cases using non-surgical robotic laser spinal decompression. It's the best way to see how real people just like you got results with this advanced treatment.